Good evening. Thank you all for coming. I'll begin with a small disclosure. Uh, I have to confess to kind of metaphysical confusion about the purpose of my presence here, because I have no expertise in artificial intelligence or precision medicine or genomics or intelligent systems or any of the rather impressive incantations that dominate the future tense of medicine. I think I'm the kind of control specimen. I'm a reminder of the pre-algorithmic age. But I'm delighted to be a part of this illustrious panel. And I'm sure all of us are here for some sort of an education. So I'm going to begin with a very provocative statement that was made in 2019 by Vinod Khosla, who's a billionaire venture capitalist and co-founder of Sun Microsystems, at some keynote somewhere in the world. This was in 2019, and Vinod Khosla said that any radiologist who plans on practicing radiology 10 years from now is going to be killing patients every day. What he meant was that 10 years from then, from 2019, artificial intelligence tools would have become so advanced and so competent and so efficient that they will consistently outperform doctors, particularly in diagnostics and reporting. Now, I'm going to give you 2 bullet points before we launch into this. The first is that I came across 2 papers. The first of which said that autonomous AI had a sensitivity of 99% in finding abnormalities in a chest X-ray. So you're looking at a chest X-ray and trying to find out if there's something abnormal there. And autonomous AI, just a machine, had a 99% sensitivity of finding something abnormal there. Compared to that, radiologist had a sensitivity of about 73%. You're approaching that number as regards finding cancer in CT scans of the lung and trying to classify kidney cancer in MRI scans. You're arriving at a figure close to 98, 99% when it's done by artificial intelligence and machines. So they're not just rivaling radiologists and physicians, they're actually exceeding them. They're outperforming. That's the first kind of bullet point. The second one is that one of the leading causes of death globally is medical error and diagnostic error. If you are to consider figures from the United States, 800,000 lives are lost or are permanently disabled per annum. Every year, 800,000 lives are lost or are permanently disabled by a diagnostic error or a medical error, right? So this is where we are. And I think I'll begin with you, Rachel. We've arrived at a point where, in a narrowly defined domain, machines are able to surpass clinicians in the act of making a diagnosis. How do you feel about this? And I wonder if you think this is, for a certain generation of physicians and surgeons, a kind of liberation, a kind of release from medicine's cognitive drudgery? Or do you think this is a deeply unsettling moment when you think that the very act of judgment has become delegable to a machine?
So thank you. Very, very interesting first question. And I think the key word is a word you've just used there. It is judgment. So an essential part of being a doctor is using your judgments to try to do something very simple but very fundamental. Help the patient in front of you to live their life as healthily as they can and as well as they can on their own terms. And in order to do that, you have to synthesize and make judgments about an array of many, many different kinds of information. So one kind of information might be hard data that you obtain from a scan. Another might be blood tests, numerical figures on a blood test. Another might be what your patient tells you about what's important to them, the history that they give you, the things that they don't say, but their body language communicates. So there is a whole array of different types of information that a doctor uses their expertise to synthesize and assimilate to try and do the best job we can of enabling that person to live as well as they can on their own terms. And what I would suggest is, in a narrow sense, there is no doubt that AI is tremendously exciting as a new revolutionary tool in medicine, in the same way as, for example, another older technology, CT scans, X-rays, revolutionized what we are able to do as doctors. But in a sense, that skill that you've just described, analysing X-rays and doing so with a much, much higher skill and accuracy than any individual human doctor can with our very small brains, which are small compared to big computers. In a sense, that's a very easy task. It is simply the task of pattern recognition. You pump the patterns, the data, into your AI algorithms, and the algorithm is better at recognizing an abnormality than a doctor because it's all really simple. It's about pattern recognition. It isn't about anything more complex or nuanced than that. So when AI can do that more effectively than a doctor can, and it can free up doctors' time to do the more difficult, complex tasks, then I think it's tremendous. It's a force for good. But where I would caution and say, hang on a second, let's not get whipped up in the hype here, is the kind of very grandiose promises that are made by many, many biomedical tech firms now about AI being able to, for example, diagnose a condition more effectively than a doctor, which is a vastly more complex task than simply reading black, white, and grey shadows on a screen and picking up whether or not the pattern of those shadows points to an abnormality on an X-ray or not. So incredible advances in a narrow sense, but even autonomy, the notion of autonomous, I would push back on and challenge when it comes to AI. I don't think that an AI algorithm reading an X-ray is any more autonomous than a calculator coming out with the correct answer to a very big sum that we can't do ourselves in seconds in our brain because our brains aren't wired that way. That's not autonomy, it's pattern recognition. And I think that the art of medicine, which is fundamentally the marriage of science and humanity, is a much, much more complex practice.
Right, indeed, because I think it also speaks to the question of epistemology, because our profession, the medical profession, is organized around ways of knowing. What we call trained intuition or pattern recognition for us is the incremental and sequential acquisition of knowledge. I mean, there's a study of anatomy, physiology, biochemistry, upon which a study of pathology is built, and then the clinical subjects, and it all comes together like a narrative in the clinic, like all the pieces of the jigsaw puzzle fitting together. And into this strides the algorithm when it's making a diagnosis. What is the nature of that knowledge? Both of you have various stakes in artificial intelligence. What is the nature of that knowledge? How can you explain it? And do you think medicine should be comfortable to act on truths that are difficult to narrate?
Well, I'm not, to be disclaimer, I'm not a hands-on expert in AI, but at our place, we work at an interface of biology and AI, if not much on radiology. So what happened to biology about 20 years back, if you take last 2010 to 2025, last 10 to 15 years, the way the data and biology, today we call it as data biology, is what has happened to this field is exemplary. It's actually revolutionary, if not disruptive. In many situations where humans cannot decipher certain conclusions out of data, whether it is a pattern recognition, whether it's a machine learning, it's a neural network, if not on the reasoning part of it. The AI or the algorithms have made it far easier for any scientist or for any medical person to understand, to summarize, and conclude certain things far easier than what it used to be. So, whether we like it or not, day to day, this aspect of AI is slowly creeping under our desk. And without a knowledge, we are doing certain things every day using AI, and they are becoming practically useful. There are bottlenecks, there are challenges. But data and at the intersection of biology is going to be a very disruptive thing in the next 10 years. And we have to accept it and use it in a very responsible way.
No, at the outset, when people talk about AI, or when I used to think about it, you go back to Terminator, you think about Skynet, you think about the end of the world when at one extreme. But on one side, what you actually notice is there are movements that are happening slowly and then all at once, right? So Cure.ai, which is a company which does radiology reading, it took a while for them to get to the pattern recognition. But now, the work they do is phenomenal when it comes to, for example, in the NHS, where you don't have enough radiologists. Their ability to at least triage and say, okay, these are x-rays that you need to take a look at, right? And they were developed for tuberculosis, but now they detect lung cancer. So the ability for you to find lung cancer early is something that perhaps it would have been difficult. If you had an experienced doctor, you could find it, but sometimes you don't have as much experience. Um, I'm just coming back from San Francisco where I sat in a Waymo, the driverless car, and I was shocked. It is almost surreal to sit and when a car is driving around through the traffic, following the rules, and at no point do you feel unsafe. So that was something which I used to see in science fiction movies, right? Today it is reality. And so I remember at some point in chess, you used to think of humans being much better in chess than computers. You had Deep Blue. Today, people use AI to train themselves and then improve, right? So as long as this pattern recognition continues, and it will happen, that data set becomes large enough, there's no way that doctors or experienced doctors will ever be replaced. However, AI will augment their ability to help. AI will augment their ability to help fast, and AI will augment the ability to find issues sooner and find solutions faster.
Let me just very briefly take a poll of the audience. Do you think the time for politeness is over? Do you think that the well-being and net benefit to patients is better than the loss of jobs as radiologists? Raise your hands. That's a yes. Right, okay. Anyway, thank you for your response. I'm going to move to another topic, which is what Ram specializes in. For the longest time, we understood disease as a kind of derangement of the structure or function of the body, as a kind of disturbance in physiological processes caused by identifiable biological mechanisms. But now we've we've developed a different theory for malfunction and disease, which is that it is a kind of spelling error. It's an error in the code in the DNA. It's a typographical error in the very text of life. And not just cancers, but many diseases can be understood as caused and manifesting on account of this typographical error in the text of life. So Ram works in the exhilarating frontier of genomics and next generation sequencing. Tell us very briefly about what this is and what the possibilities are and what you're actually doing at the moment.
Yeah, genomics is a very interesting space. It's there since 17th century when first theory of heredity was postulated, but the technology was not there to actually decipher the code. And it's only just last 15 years, there are technologies which can decode the what you call code of life. So we all have, every living organism has DNA, RNA. It's a code of life. It's the essence of life. So what you are, what you're going to be, what your ancestors have been, how you function, how you live, what diseases you get, everything is there in the code of life. How you interact with the environment, everything. And as Paul Berg, Nobel laureate, said, every disease is genetic in origin. Now, if anybody are not convinced with this statement, we can discuss after the session. I can explain you everything. Virtually every disease is genetic in origin. Now, how much is the genetic component for each disease varies. Some are 100%, some are 20%, some are 30%. So today, if you look at starting from disease predictions, how treatments work, how evolutionary adaptations have happened for humans, why are certain races different, why certain adapted to certain environments, why certain humans could not adapt, starting from 300 years back when modern humans have come in, everything is ingrained in this genetic code. So it becomes very essential for us, if not in all situations, in many critical situations, to understand this code. And last 10 years, it has become very cost effective to decipher the code. Today, we are in a state where sequencing or decoding this code is not expensive. It's a commodity now. The bigger challenge today is how to really understand this whole data that comes out of it. And that's where I was talking about the AI, how it will help. We're all hopeful that it will help us in the next 5-10 years to make it better meaningful of this data, because today one of the biggest bottleneck or the challenge that we all have is the 3 billion letters that we sequence every day. And when it comes to a country like India, it's a very large demography. We are talking about 1.4 billion population. We have 100 million rare disease patients at a given point of time in India who are seeking answers for the disease. We're talking about thousands of cancer patients who are looking for right treatments. We're looking at people who take drugs. They may not be metabolized properly. They need to be given right dosage at right time. So there are many unanswered questions for whole of 1.4 billion population needs to be addressed. So this is where the genomics plays a critical role. It's a very complex field, still a lot of things to be answered. But good thing is the technology has taken us today where it is relatively much inexpensive compared to a decade back, and it's far economical for even a common person in India to understand what is their code in various situations and change their lifestyles, change their diets, change their drugs as per what the code is there. So every day, for example, a laboratory like us, there are many other laboratories in the country and the world who do this job. We just sequence these codes primarily for medical purposes, sequence and understand, analyze the data, understand where the changes in this code in these individuals who have disease, and give right treatments or prevent certain diseases. This is a fast evolving field. We hope in the next 5 to 10 years we have more answers than what we have today.
Indeed, and I'll give you an example of how this works. I mean, you've got cancer of the lung, and there's an error that has been identified in the sequence. This error will tell you what pathway is failing, what drug is likely to work, what drug is likely to fail. So it's entirely possible that with the same diagnosis, different people will get different medicines. In my own practice, I'm a vascular and endovascular surgeon. I operate on blood vessels. One of the procedures I'm required to perform is stroke prevention surgery. And in matters of stroke, when you've got a clot, you give a drug which is called an antiplatelet agent. It's a blood thinner. And an example of this drug is called clopidogrel. Now, this is actually a prodrug. What that means is that the pill you swallow is not active. It goes inside your system, it's metabolized by the liver, and it's converted from the prodrug to an active drug. Now, many of us sitting here don't have the right enzyme to actually convert this prodrug to an active drug. And if someone's had a stroke and you're giving them this medicine, clopidogrel, you're effectively gambling with a second stroke because you have no idea if it's going to work in this case or not. So sequencing will precisely tell you if there's a genetic error that allows them to convert this prodrug to a drug or not. And I'm quite surprised, actually. I was chatting with my son who's just begun his undergraduate studies, and I'm told that this kind of engineering at the genetic level, the CRISPR technology, which is like a molecular pair of scissors, you've got generative AI tools that are freely available on GitHub now, which is like a GPT for CRISPR. You can say that, I have this specific gene for cancer of the lung needs to be turned off. And the GPT will give you information about this is the specific kind of molecular scissors to be used, this is the Cas9 to be used, this is the guide RNA to be used. So, and this is free to download on GitHub. I mean, that's where we are. Drug discovery generative pipelines and repositories of codes are available on GitHub and other sites, free to download. Anyway, I'll turn to you, Karthik. This is not a hypothetical for you because you're sitting on a lot of money as an investor. And if I were to ask you, so forgive the lack of coyness here. I'm going to ask you very specifically, if you weren't chasing quarterly profits, and if you're looking at the kind of structural inevitability of success in the future of medicine, particularly in India, what are you going to place your bets on?
Since we invest only in healthcare, I think we invest across the spectrum globally. But I think in India, the place we spend most of our time on is in either innovative technologies, and that's why we invested in a company like MedGenome and Cure.ai, or we invest in healthcare services. So we invest in companies such as Medanta, Manipal. We recently invested in a company called, or we'll be announcing it soon, which is focused on neonatal intensive care. So for example, in a country like India, where you have a significant number of premature babies, right? The ability for them to actually manage care for babies who are born, call it, instead of 9 months of pregnancy, in 5 to 6 months of pregnancy is phenomenal. So I think India, in the space of healthcare, where we are exceptional is in doing the routine things right. I'd argue, if you go to an ortho surgeon in India, a vascular surgeon in India, we are significantly better than most other countries because of pattern recognition, because you see that pattern again and again and again, and because you're doing more of those surgeries, just given the population. And so our view is we need to make India the medical hub for the world for all of these things, where people come here to get the treatment. I'd actually argue if you want to do a simple bypass surgery and you have the luxury, it is better to do it in India than in the West. And so as investors, I think we're long-term investors. We're willing to wait, not the standard 5, but even longer than that. But I do feel like those are theses we invest behind.
Let me reframe this. Let's say you weren't Novo Holdings, but you have like a large corpus of money. And for some unfortunate and cruel reason, you can only invest in one particular layer of healthcare. and this is about the future of medicine in India, what would you invest in? In data, in diagnostics, in delivery, in infrastructure?
If I had to pick one, I'd pick healthcare delivery in tier 2 regions, because that's the area which is significantly underserved as of today. So in a place like Delhi, or in a place like Bombay, or a place like Bangalore, it's very easy to get good medical care. And I do feel sometimes we say, hey, there's profit on one side and there's care on the other. I don't think that they separate. There is a way in healthcare that you make sure that is done in an empathetic way, which also works for the patients. There are numerous examples in the country of where people still charge the bare minimum but still make money, and we just need to find that. We need to be patient enough and find that. So if I had to pick one, it would be healthcare in tier 2 cities.
What do you think, this is to all three of you, what do you think is the most overfunded idea in healthcare, globally or in India?
I think there's a lot of money chasing health tech, right? So there's a lot of money chasing, in India, for example, you have a lot of money chasing 10-minute pharmacy deliveries, right? So, I mean, it is helpful, it is useful, but I think sometimes in India we also start chasing things which maybe aren't as relevant. You could perhaps spend it on, do you really need your eggs or your bread in 10 minutes? Or would you rather have better, use that for better ambulance care, for example? You don't have good ambulatory care in India as of today. So I think those are areas where sometimes we, as investors, also get blindsided, and we look at things which are sexy but not necessarily impactful. And yeah, I think that's my view.
Yeah, and to pick up on that and maybe flip that question on its head, I think the most important question is not what are we perhaps squandering resources on, it's more fundamentally, what are we not spending resources on? And actually, we all know in healthcare what we're not funding sufficiently. And very often it's the singularly unsexy, untechnologically exciting, unsophisticated, but vitally important, simple, cheap healthcare, particularly preventative health, that can vastly enrich the health of populations. But because it's not sexy, it's neglected. And sometimes, because it's about populations who are vulnerable, it's not prioritized. So the single greatest determinant of health, I would strongly suggest, is not your genomics. It's not the precise details of your particular personalized human genome. It is whether or not you are poor. There are profound socio-economic gradients in health. And that means, in its simplest terms, if you are poor, you are more likely to be sick and you are more likely to die. So in the UK, for example, if you start in central London and you travel on the tube train, the underground metro in London, out of central London into the poorer outskirts of London, every tube stop along the line takes a year off your life expectancy, because that transition from rich London to poor London has a direct effect on your life expectancy. So that is where we should be investing money if we want to improve the greatest health of the greatest number of people overall. But nobody's ever going to invest in that because it's not going to make a smart profit, and it's not sexy, and it's not going to give governments a sexy headline that they can seduce voting populations with. So I think it's really important to take a breath when we're thinking about tech in relation to health, because I don't dispute that these innovations aren't wonderful and exciting, but they all involve money that isn't being spent in other ways that could profoundly help particularly vulnerable populations in society.
Indeed. I think, so healthcare investment can either chase disease downstream, which is, ICUs, dialysis centers, tertiary care hospitals, or it can chase disease upstream, which is what Rachel is saying, preventative medicine. And because in India, we cannot afford millions of people being on dialysis machines or millions of people getting amputations, there is a particularly idiosyncratic South Asian problem as regards diabetes. It is believed that in Europe, for instance, you have to be fat to be diabetic. In India, it's believed that you have to be Indian to be diabetic. It's linked to poor nutrition and bad genes and an underpowered pancreas and many other factors. But you need to chase disease upstream so that our infrastructure can be better managed. And I think one final question to all of you, particularly to you, Rachel, because you're the clinician. I think what's happened with modern healthcare and modern healthcare systems is that it seems that these healthcare systems are confused, or at least are wrong about what they are and who they exist for. And it seems to me that increasingly outcomes are being confused for values. So healthcare outcomes will be, complication rates, salvage rates, survival rates, length of stay in hospitals, cost per case. These are measurable metrics. Values are dignity, autonomy, kindness, honesty, meaning at the end of life. These are hard to measure. As a palliative care specialist, do you think we're confusing outcomes for values?
I absolutely do, and I suspect that many of you in this audience will have experienced healthcare that made you feel like an object that was being processed through a system that was not treating you as a human being with basic, simple care and dignity that maybe helped, for example, with the fact that you were afraid or you were embarrassed or you were having to pluck up the courage to talk about something that you felt ashamed of. These are all things that we do with doctors. And I think there is a great drive in modern medicine to equate value with anything that can be measured objectively on a spreadsheet. And if you can't measure it on a spreadsheet, then it doesn't exist. It doesn't count as valuable. So my specialty, palliative medicine, is a really good example of where that applies. I help patients end their lives with as much dignity and as little suffering and in as close to the way that they would like as possible. And sometimes we might do that in really radical and surprising and quite beautiful ways by finding out what matters to a patient. So I'll just give you one very quick example. I once cared for a patient who was a farmer, and he was dying of cancer in the hospice where I worked. And we said to his wife, is there anything that would really make him happy, that would bring him a little bit of joy at the end of his life? And she said, well, there's one thing, and I don't know if you can sort it out, but he'd like to see his prize-winning bull one more time before he dies. He loves that bull far more than he loves me. So we said, okay, we'll see if we can make that happen. And we organised for a tractor with a trailer pulling this bull, this enormous, dangerous bull, through the grounds and the car parks of the hospital to get to the back where the hospice was. And he saw this bull, and his wife was absolutely right. He lit up with more joy than he'd ever shown her in any visit. He was delighted to see this bull. And a few days later, he died. Now, that experience transformed the end of his life and the memory of the way in which he ended his life in his family who lived on. but it doesn't exist in any spreadsheet. It has been erased from our productivity as a hospice, and yet it was one of the most beautiful things I've been involved in my time as a palliative care doctor. If we only value what we can count on a spreadsheet, we are fundamentally forgetting that the subject of medicine is not atomic, it's not objective, it's not physical, it's a living, breathing, beautiful, frightened, frail, mortal human being. And our job is to help enrich the life of that human being in all the ways we can. And sometimes the way we do that is through brilliant, brilliant genomics or incredibly precise analysis of X-rays or MRI scans. But sometimes it is through the least high-tech, cheapest chips interventions. You are dying of cancer, and I lean over and I show you that I care. I look at you. I hear your fears. I show you that you're not alone at the end of your life. That's priceless medicine, and it doesn't exist on a spreadsheet. So we must never, ever forget the importance of that.
So we just have time for some questions. Goodness. Would someone... is there someone with a microphone? Right. The gentleman in the shawl, perhaps?
Good evening to all. Thank you so much for such an enriching session. So my question to any of you can answer that we have a term in preventive medicine, primordial prevention, that we are eliminating the root causes and factors that create disease. That is sort of an intervention before the disease is there. So when we talk about investment in healthcare, I would like to ask, where do you think India stands in the terms of awareness towards primordial prevention? Because whatever we talked about was mostly secondary and tertiary prevention. So yeah, that's my question. Thank you.
Let me take it first and I'll ask the others. I think we're far away at this stage. I mean, forget primordial prevention. How many of you have taken a blood test to do just to check your markers in the last 6 months, right? The cost of doing that is so low, but if you're able to find something, it is massive, right? So I think preventive healthcare in India is at a very nascent stage. I think that needs to progress soon, fast, and then we'll get to primordial prevention. I think the work that Ram and MedGenome does will help on that front. But I think each of us need to make sure that we do our preventive checkups, because then we are able to reduce the burden on the system as well if you're able to correct things early in our own health journey.
Yeah, I think it starts at individual level, more than investments or what investors or government can do. I think the lifestyle, simple basic things of activity. So awareness is extremely important. And I think if at individual, we're a large country, right? There's so many people who are educated, who don't know anything. So it takes a lot of time for people to understand that before even we talk about fancy tests, before we talk about anything on AI, there's simple things in life about what you eat, how much activity you do, how quality of sleep. These are extremely important ones for preventing lifestyle diseases. So I think it's a very complex topic, but yeah, that's a good question.
The lady in the spectacles.
Thank you very much. I wanted to ask you about AI hallucinations. Given that we put a lot of stake in the value of AI, the fact that it can actually make up citations and obfuscates and fabricates facts is something we need to grapple with. What is your take on that?
Well, I think not that I'm any kind of an expert on this, but the specific kind of AI diagnostic tools that are used for pattern recognition in a very narrow domain take care of hallucinations. I don't think that's a concern here. For general purpose, generative AI, I think that is a real concern. I think the smart people who are dealing with this have taken care of that.
I mean, so maybe right about predictive versus generative AI, but I think maybe a broader point that you've touched on is, can we be confident about these technologies? And obviously one of the concerns is when AI hallucinates. But another is the extent to which we can rely on these technologies given concerns over what data are inputted into the model. And there are huge concerns around inherent racism, sexism built into the algorithms because the data are skewed from the outset and therefore are essentially judging normality against a sort of 70 kilogram white male, which does not match much of the population. So I think that these are real important concerns, and I don't have answers for them, but I think it's not being a Luddite and anti-technology to raise these concerns because the potential for harm is significant. We would never introduce a new drug without rigorously testing it and make sure that it didn't have quirky or rogue results in patients. And yet, perhaps in the excitement and hype, we are applying much laxer standards to these medical interventions in AI form.
Right. The gentleman there with spectacles? Yeah.
First of all, thank you so much for this enlightening session. I am an AI researcher, and I feel so generous that like all of us have gathered here talking about AI. My question is that so when I'm like talking about or researching on AI, and specifically I work in interpretable expert systems for diagnostics, my guide says that you are an engineer, you're not a doctor, so you can only warn but not diagnose. So the first thing that we really take care about is that we warn, not diagnose. So my question is that even though AI researchers are not working towards replacing radiologists, but why is there so much resistance upon giving data towards AI research? Because I personally have felt this resistance myself when I go to institutions asking about data about medical field and clinical fields, especially clinicians who are working in these fields not related to radiology. Radiology is very welcoming, but other fields do not welcome AI researchers as such. So my question is that.
Have you
So-
encountered resistance?
Yes.
Yeah, for data labeling?
Yes.
Right.
Yeah, I think it's natural for any new technology that too, when we expect it's going to be disruptive, it's going to replace somebody, people expect to be little, opposing towards it. But I think the approach at what you take for to solve a problem, and also there are controversial aspects of data. When things are taken in the right way and did in the right way, I don't think all the opposition will go down. But as long as you do certain things not in an appropriate manner, I think these controversies will continue to happen. I don't see that will go down, and it will continue. And these kinds of whether how you make an AI tool or make an AI algorithm, where you're getting from data, how you are getting the data, how good is the data, what are you interpreting? Are you over interpreting, or are you hyping up certain tools? These all matter a lot. But as a core technology, as a core concept, it's a very powerful concept. Okay, so no denial about it. But how you use it and how you develop it is something matters, and that makes people ask many questions or oppose or become controversial. So that's something that we need to be careful about.
Okay, of course.
The gentleman in the back there, in the rear, yeah.
Hi. As many of us are doing PhD in field of AI and computer vision, I'm also a researcher. And I was a government teacher a few years back. I was teaching kids there. So that helped me to understand AI, and that's why I choose this field. So I want to ask Ram or Karthik that how at grassroots level, at village level, the Indian education system can teach AI. Like I'm so motivated by the 2024 Nobel Prizes, both chemistry and physics, CRISPR, AlphaFold, whatever you go. Uh, uh, I want such kind of change from Indian grassroots, from Indian villages. So what we can teach in Indian schools or Indian education system that can bring such enormous changes to the global stage.
So, sorry if I repeat what you asked. You're asking how
How the
these.
Indian education system can evolve or can change, what we can teach in grassroots level, in village level. Like people in remote areas and villages, that kids I was used to teach, they are using Chat GPT and Gemini now in everyday use cases. So what we can bring to their table in field of AI and medical, like what we are discussing here,
Yeah.
how we can bring to them.
Yeah, so it will take time, but I can give you one side, one example. In India, what has happened, I think Karthik has already cited. There are few companies, I'll name one. There's a company called Cure AI. Um, I'm citing that example because we work with them. I'll give you an example how it helps at a grassroots level in remote areas. Okay, so we have to screen about 10,000 individuals for tuberculosis using chest X-rays in just a month's time. Okay, there are multiple X-ray machines. There are not enough radiologists to screen it. Okay, so this algorithm passes the data and picks up all doubtful ones, reduces the number that few radiologists can screen and identify. So triaging in remote areas with poor infrastructure, with not too much of resources is one example. There are many examples. As the technology evolves, this is one area where many of them are focusing on as how these technologies will help.
I think we're still,
You're missing
even
my question. Actually, I was asking, you are implementing the field. You are implementing AI and in remote areas. I want to know what we can teach the kids so they can learn such kind of things.
no, so I'd say for the children themselves, right? I think I'd put two things. One is they're not, many of them are not aware of this, right? Even my child who is in a metro is not very aware of AI. He is, in India sometimes when I was studying, I used to study log books, right? While at that point you had computers. Today, kids use calculators or even code versus you have AI. So I think our education system will need to move a bit forward and forget education. Even the premier institutions in the country, right? We are currently, you don't have really good places to study AI. Many of my batchmates are abroad doing, path-breaking work on AI. Would they have that opportunity in India? No. So I think the fact that you have heroes in this segment, the fact that you have Indians who are doing this abroad, the fact that you have, if you're able to build our own, native AI tools, people who do it right now from your generation, that will inspire the younger folk to, to learn more. I think it's an organic process, takes time. I don't have a silver bullet solution for at the grassroots level, but I am pretty confident that the next big AI algorithm will come from here, because there will be a few people who are smart enough, hardworking enough, who are going to go against the grain and build something that is bigger than ChatGPT or build something that's bigger than any of the other ones that you're seeing out there.
Right. I'm afraid we've completely run out of time, so we end the algorithm here. I thank you all, and thank you everyone for joining us for this session. Thank you.